time for the urinary system. Not a very complicated system, at least we're not going to get into the physiology too much. But the functions of the urinary system include regulation of the chemical composition of body fluids and also removal of the body waste by filtering the blood. And there's a lot of physiology to that, but I think for now we just need to know that it regulates your fluids and rids your body of the wastes by filtering it out of your blood. The parts of the urinary system, you've got two kidneys, they're fish-shaped in your lower back, and your ureters that come off of the kidneys, your bladder, and your urethra, which is a tube that carries urine outside of the body. The kidneys are about 4 inches long, 2 inches wide, weigh about 150 grams, less than a pound each. Each kidney contains 1 to 2 million nephrons. Nephrons are the powerhouse of the kidney. They're the filtration device, and they are really the key to ridding the body of its waste. There's 3 layers to the kidney. If you were to cut it open, there's the cortex, which is the outer layer, the fatty medulla, deep red area, and the renal pelvis, the funnel-shaped area where the filtration occurs. Here's a little picture of what it looks like in relation to the rest of the body. You've got the renal artery that feeds the kidneys blood. That's right here. And actually, at any given time, you can have 20 or 30% of the blood volume in the body going through the kidneys. They're very blood-rich at any given time. You have the ureters, which are the small tubes that come off of the kidney, and through peristalsis, the same kind of motion, muscular propulsion motion in the esophagus that moves food, there's also a propulsive peristaltic motion in the kidneys that moves the bladder. The bladder is a smooth muscle sac, and it expands as it fills with urine. There's nerves in the bladder to give you that urge to urinate or void, or pee, whichever term you prefer. And then the urethra is one tube that moves urine from the bladder, that smooth muscle balloon, to the outside of the body. And the urinary meatus is the opening at the end of the urethra where urine passes outside of the body, and that opens and closes to allow that to happen. For urine formation, every minute blood plasma enters through the nephrons of the kidney. Again, that's where it's filtered. And the nephron particles are filtered from the blood to be eliminated. Water, glucose or sugar, vitamins, amino acids, or what happens when proteins break down, and chloride salts are reabsorbed into the blood in the renal tubes. Ammonia, potassium, hydrogen ions, and some drugs are secreted in the urine. Ammonia is toxic in the blood at elevated blood levels, so actually the liver breaks down the ammonia into urea, and the body excretes the urine ammonia content. And then the blood leaves the kidneys by way of the renal veins. And some characteristics of urine, just that you should know, urine should be light yellow, straw colored. If it's too dark, if it's too amber, it's a sign of dehydration, maybe some red blood cells in the urine, things like that. Urine should not have sugar in it. Urine should be sterile. And you should not be having any protein or ketones in your urine either. That's a sign of muscle breakdown. You shouldn't have pus in your urine. And there are usually dead skin cells, dead epithelial cells in your urine, and those casts, they're called, are common. But typically urine should be clear, straw colored. The lighter, the better. To do a urinalysis, you look at the color, you look at the clarity of the urine, the pH. Urine is slightly acidic to help so bacteria doesn't grow. And there's something called specific gravity that measures what the content of dead cells and things are in the urine. So looking at a specific gravity that's high would show there's a lot of sediment in the urine. Low, that it's, maybe someone is overhydrated. So doing a urinalysis is a form of assessment. Urine should not have an odor. If it's too concentrated, it's a sign of dehydration. Sometimes medications cause urine to have odor. Some foods cause urine to have odor. Asparagus is famous for that. You should urinate about 1 to 1.5 liters every 24 hours. That's a quart or a quart and a half. And the prefix that means without is would be no output of urine. Oliguria could be a dehydration where you put out less than a half a liter a day. and that could be a problem because you would be dehydrated. Polyuria, when you put out more than 2 liters a day, that's too much urine, and you could become dehydrated quickly. And then diuresis, when all of a sudden there's a huge volume of urine that leaves the body, is also an indication that there could be a threshold problem with holding on to the urine, or an issue with the antidiuretic hormone. Ways to assess the kidneys: there's x-rays. You can do injection of dye and then do an exam that way. That contrast medium is the dye that they put in. It travels through your kidneys, through your ureter, maybe looks for any blockages, checks on the circulation and that kind of thing. You can actually scope the bladder. That's called a cystoscopy. When that scope is inserted into the urethra and up into the bladder, they inflate the bladder with some air or water so that they can visualize that and be looking for signs of tumors, growth, bladder cancer, that kind of thing. And then there's urodynamic tests that check the flow and the ability for the bladder and the sphincter muscles to control the output of urine and the intensity of the output of urine or the retention of urine. Disorders of the urinary system include renal failure where there's no urine formation, uremia, which is when the kidneys don't filter blood and blood spills into the urine. That's an abnormality. Urethritis, which is inflammation of the urethra, usually from bacteria. And urinary incontinence is the inability to hold urine. So basically wetting yourself is incontinence. Some issues and innovations that have helped with urinary issues. Big one would be the dialysis, and we're going to have a representative from the dialysis unit come and talk about the different ways that they can filter toxins out of your blood manually or chemically using machinery if your kidneys are not working. And that's what dialysis is. And most people have to have dialysis once they start it. You have to go every couple of days unless they do home dialysis, which is a nightly thing. And it takes many hours and can be very confining. So here's just some lifestyle changes with dialysis. They often have trouble sleeping, they're anemic, they don't feel good after they've had dialysis, or they don't feel good right before they go because their body's starting to fill up with toxins and they need their blood to be filtered. They have a big problem with fluid retention, and they have to be very careful of their sodium intake, their protein intake. Often they have dry mouth and bad breath, and that's always a struggle because of their severely restricted diet, and their skin can get very dry, their hair brittle, and get itchy, and they really should avoid the sun too. So there's a lot of lifestyle changes on top of being hooked to an IV for 4 hours a day or hooked to a flushing system that takes all night. Just as an interesting little slide, just to show you what it costs typically for a heart transplant, a single lung, a double lung, a heart and lung transplant, a liver, kidney, pancreas, and the most expensive is the intestine, along with the combined heart and lung transplants. That's why we have insurance, and hopefully nobody will have to confront any of those hardships. Lithotripsy is another innovation where you've heard of kidney stones, where there's minerals that build up and there's kidney stones formed often right in the kidneys or in the ureters coming out of the kidneys. And they get stuck up there, and that area is very sensitive. The ureters are very sensitive, the kidneys are very sensitive, and so the idea is you've got to get those stones out of there. And if you can't push a lot of fluids on a person and have them flushed out, sometimes they have to go in and break them up using shock waves, and that's called lithotripsy. And this is a lithotripsy machine that's usually done in the operating room, and they actually bust apart the stones in hopes that you can pass them. So 10 minutes or less, that's the urinary system.